I've always been interested in brain science, from studying artificial intelligence at MIT and like sneaking across the street, as they call it at Stanford when I was doing my MBA there, to take weird classes like philosophy of mind and philosophy of consciousness. After a career more in the classic kind of internet software industry, as an operator, as an investor, I finally decided I really wanted to start something with more impact. So we usually talk about how we're like the ATMs of behavioral health. So if you think about what ATMs did in the banking industry, they essentially took a big chunk of labor-intensive activity that the tellers basically engaged in with their clients, and said, we can actually do this through digital self-service, through this little machine outside. And we're doing the same thing in behavioral health, which is to say a big chunk of that activity that traditionally you think of a therapist doing with their patient, we can actually do through similar digital self-service. We've been lucky to work with a lot of really great organizations, starting with the U.S. Army, who we signed one of our first major contracts with a couple of years ago. We've been up and running in a number of different Army facilities across different care settings. We just recently signed some pilots, one with a major HMO, one with Sutter Health and their EAP group. We have benefited in a number of different ways, both from the introductions that we've gained from being part of the Startup Health community and directly from the Startup Health team, as well as, of course, from interactions with the other entrepreneurs. I just had a call this morning with an investor that I met through the last Startup Health pitch day, which was fantastic. They're specifically focused on behavioral health, so just a really great fit. Met some really interesting people yesterday that in terms of healthcare systems that are looking for tools just like ours. So the opportunity to kind of engage with these folks in a highly curated way has been very valuable, and is leading to some very interesting both customer and investor relationships. And in some cases, it looks like we're leading right into contracting, which is great. Those things just wouldn't have happened, or wouldn't have happened nearly as quickly if it hadn't been for those introductions.